Questions here, who is also for Dr. Mwambene. This person wants to know, because of COVID-19 pandemic, more people are experiencing mental health challenges. What are some of the health trends that you have observed, as well as the advice that you can give as a result of the pandemic?
Okay, thank you. What I've observed as the mental health trend now because of the COVID-19, I would like to categorize maybe into three major groups. On the patient trends, on the health care providers trend, as well as on in the community. On the patients, I've experienced that post-COVID-19, people, they've developed mental health complications that they didn't have before. Like, I've attended 2 patients who they've developed cognitive impairment, including poor concentration, poor memory. Some have slowness in the thinking, speech problems post-COVID-19. And this has been so, and some of the research that have been done, especially there's one ongoing research in Canada by Vox Neuro. They've confirmed that this is a post-COVID-19 complication that is now increasing, and the impact is delaying. It can take even 1 year, 2 years. Some patients, they can have permanent one, but they say with time, with a proper intervention and rehabilitation, they can recover from that. But that is the trend, and I've already seen in 2 patients that I've been attending. And the other thing also on mental health impact of COVID-19 that I've also observed, the patients who have developed a new onset of depression and anxiety, which they didn't have before the COVID-19. And this also has been proven that this also is a manifestation of the functional abnormalities of COVID-19, functional brain abnormalities of COVID-19, that the imaging of patients who develop a new onset depression, anxiety, also even psychosis, including a lot of visual hallucination post-COVID-19. So that is the trend also in terms of the patient. As I said earlier, also a lot of the anxieties. And also among children, also I've seen the children with behavioral problems, behavioral changes, behavioral abnormalities. And I have already even seen a patient, a child who is 11 years old with a suicidal ideation because of the loss of the parents. Now the orphans are increasing. That one was double orphan, like both parents have died within a period of 2 weeks. So that boy developed a suicidality, wanted to kill himself because of that loss of the parents. So that's, in nutshell, I can say on the patient side. But also on the health care providers, this has been really affected the mental well-being of us healthcare providers. A lot of nurses and doctors and other healthcare providers, they have a lot of burnout. They're in a lot of stressful situation. There are other call me and crying. They say, "Doctor, we cannot go on like this anymore." And this is because they've been exposed with a lot of patients who are dying. This is not normal. We know at the hospital patients somehow in one way or another they were dying, but the trend that is going on now, a lot of patients are dying, which is also, healthcare providers also, they are human beings, they have emotions. So seeing every day patients are dying, they're trying to do their best to save their lives, but at the end of the day, patients are dying. Breaking news to the family for the death of the loved one, this really affecting the healthcare providers. So this also is the trend that I've seen, increasing number of healthcare providers with anxiety. There's one who came 2 days ago, came to my office, said, "Doctor, I want to quit. I don't want to be a doctor anymore." And she was really crying, saying, "No, I cannot handle this situation anymore." So this is a trend that has been going on, a lot of burnout among healthcare providers, which really complicates to mental health complications, including depression. And the other trend now in the community, as I said earlier, there's a lot of anxieties in the community, and this affects both elder people and the children. There's a lot that is going on among the children with the lockdown, not going to school, limitation of to go to play, meeting friends. So this also contributed to mental health complication as the trend after COVID-19 or going on with the COVID-19. So my advice now, how to prevent or how to deal with this situation. First of all, what I can say, we have to take care of ourselves. And self-care including both the care of your mind, the care of your mental, and the care of your physical, not only like physical well-being, but also your mind. What are you thinking about COVID-19? What are you hearing about COVID-19? What are you believing about COVID-19? We need to purify what we put in our mind and what we believe about the COVID-19 in our mind. And as I said earlier, if you don't know or you are not so sure about COVID-19, you better ask and have the real information, which will keep you at least away from the fear. But also, I have also to advocate the issue of seeking help. Where you think that you cannot handle situation by your own, please seek help. Whether it's within the family or friend network or professional help. Especially, I have to insist on professional help. I know there's a lot of stigma about mental health or contacting psychologists, psychiatrists, or any mental health provider. But really, during this time of COVID-19, a lot of people are suffering from mental health complications, and they are keeping to themselves because of this stigma. Please seek help, come to us, say what is bothering you so that we can help you. Also, let's learn how to develop the good coping strategies. Let's not cope by using drugs like alcohol or other substances, because this will make more harm to our immune system, to our mental well-being, even to our physical health. So the good coping strategies is also very important. At workplace also I can insist, or I can ask, or I can request the managers, the supervisors, whoever is the leader at workplace, really let us have concern with the mental well-being of our staff, our juniors, colleagues. Let's help each other. If you see your colleague at work is not doing so well, let's offer support. And the leaders also, when someone feels like he cannot handle, she cannot handle, maybe she suffered a lot from the loss of loved one, or there's something that a sick person, let's offer help and let's try to understand that, because the mental well-being at workplace is very, very important. And sometimes if you find someone is vulnerable, let's try also to, if it's possible, it's applicable at that particular nature of work, let's try to, I cannot say recycle, but at least move from high-risk area to lower-risk area, so that to kind of distressing the situation. Let's now, someone who is vulnerable, already experienced stress, cannot handle the situation, also keep on working on a higher risk area. I can also give the example, there's a doctor who was working in a COVID ICU and was really tormented with the situation at the COVID ICU. So at least she came to us, we tried to offer the intervention, and also we discussed with the supervisor. The supervisor was very understanding. Then she moved from that high risk area to another area that at least she's able now to cope. So these are the things also we need to consider.